The Daily 2 is brought to you by Charlotte Eye, Ear, Nose, and Throat Associates. Welcome to the Daily 2. I'm Laura Polka. Some 20% of adults suffer from acid reflux. There's also something called LPR, known as silent reflux. Joining us today to talk more about this condition is Dr. Jamie Scaglione from the Concord office. Doctor, thanks for being here. Explain to our viewers, what is acid reflux?
Acid reflux is when the acid that the stomach produces in order to digest our food gets out of the stomach and goes up into the esophagus, which is our swallowing tube. And when it does that, it irritates that area.
And are there different types?
There are two different types. The most commonly known is GERD or gastroesophageal reflux disease, which produces the heartburn sensation. The one that we more commonly see is what we call LPR, which is laryngeal pharyngeal reflux, where the acid is getting into the throat, causing very different symptoms, like a feeling that there's something stuck in your throat, chronic cough, chronic throat clearing, or even difficulty swallowing.
So, can you treat any of this at home?
So, some things that we commonly tell our patients to do is avoid foods that are big acid producers. And again, most people know about like spicy foods, red sauces, but other things like cheeses, high fat foods, chocolate, caffeine, those are all things to avoid also. The other big one is not eating at least 2 to 3 hours before you go lie down to go to sleep. They can also try some over the counter medication, but if that's not doing enough, they can come in and see us in our Concord office where we can do a full evaluation, make sure that's what's going on, and prescribe them some medication to help.
Doctor, thanks so much for joining us today. If you'd like more information about acid reflux or to make an appointment, call the number on your screen or go to wejustmakesense.com. For the Daily 2, I'm Laura Polka.